Good morning. I am Abby Roach, Chief Administrative Officer of our U of L Health downtown campus. Our CEO, Dr. Jason Smith, regrets that he had another obligation this morning, but sends along his gratitude for all you do in supporting our community, especially in healthcare. We are honored to host all of you in our newly opened atrium here in the West Tower of U of L Health. Mayor Greenberg, thank you for attending our opening celebration last month and returning to join us today. This tower is an investment in our shared future. U of L Hospital has been serving the region for more than 200 years, and with this addition and our community continued partnerships with you, we are well positioned to continue serving the community for many, many more. In addition to providing a hub for our patients, our guests, and our employees, this tower increases the size of our hospital by more than 43%. Upstairs, there are operating rooms, recovery rooms, patient rooms, a dedicated oncology floor that will be opening soon, and 2 more shell spaces for future growth. The investment in this new tower reflects the commitment of our community. It's an example of the economic impact healthcare has in our community and in this Commonwealth. This tower project cost $186 million. It's just one project, and we are just one member of this alliance. Our collective economic impact accumulates rapidly. It's because of projects like this, the jobs we support, the ongoing research, as well as the role we play in making sure our patients are able to return and thrive in their own careers. It was no secret that healthcare is such a vital contributor to our economy, but now we have data to back that up. With that, it's my pleasure to introduce Steve Cunanan, President and CEO of our Alliance, to share more details and insights. Steve?
Good morning, everybody, again, and welcome. I really appreciate everybody coming out. As Abby said, my name is Steve Cunanan, and I am the President and CEO of the newly formed Health Innovation Alliance. And this morning, I'm joined by the CEOs and leaders of healthcare companies across our region. Some of these organizations are Anthem Health Plans of Kentucky, Baptist Health System, Bright Spring Health Service, Dental Care Alliance, Galen College of Nursing, Hospice Health, Humana, Norton Healthcare, Signature Healthcare, Trilogy Health Services, and U of L Health. The CEOs of these companies that I just mentioned are the founding members of our board of directors of the Health Innovation Alliance. They provide strategic direction and guidance to our organization, and they are seated out in the audience today, and I thank them very much for joining and for their leadership, commitment, and partnership. I would also like to thank the University of Louisville Health for hosting this event. You know, we're in a facility today that is a wonderful example of the investment that has become commonplace across the healthcare community. These investments create jobs, they advance life-saving technology, and they expand critical access to care across our region. This morning, we're going to be talking about the first ever economic impact study for regional healthcare. The study comprises 12 counties across southern Indiana and Kentucky. And joining us for comments are the Honorable Craig Greenberg, Mayor of Louisville. Mayor, thank you for coming. Leanne Barney, CEO of Trilogy Health Services and the inaugural board chair of the Health Innovation Alliance. Thank you, Leanne. Also joining us are Trevor Paul. Trevor is the CEO of the Louisville Economic Development Alliance, or LEDA. Thank you, Trevor. And Dr. Tom Lambert of U of L Business School. Tom, along with his graduate students who are out in the audience today, are the authors of the study, and Tom is an expert on applied economics. This is one of many economic impact studies that Dr. Lambert has conducted. We're also going to be introducing a new organization that will lead health innovation and partnerships across this community. The Health Innovation Alliance is Louisville's collaborative for health and lifespan innovation. It's a 501c3 nonprofit, and it's focused on collaboration, partnership, and innovation in all parts of healthcare, not just one, all parts of healthcare. If I very briefly turn my attention to the economic impact study, it's very clear as you go through the information that healthcare in our community is a critical driver of economic prosperity, with 1 in 5 jobs in the region being healthcare related. The sector produces $7 billion in wages and provides an additional $7 billion of wages in organizations that support healthcare. The sector has almost 100,000 jobs, and it has another 114,000 jobs in related and support industries. You know, as a matter of fact, every job in healthcare creates an additional 4.5 jobs outside of the sector, which is very, very important. The economic output, or the revenues generated and supported by healthcare, are around $17 billion, with an additional $20 billion of revenue from businesses that provide services and support. Dr. Lambert's going to be detailing more about this study as we move through the program. You know, it's also important to note that healthcare is a growing part of our economy. Employment in healthcare in this region consistently grows at over 4% every year. Not every sector, not every industry can say that. It's an important part of what we do here in Louisville and in the region. Also, you know, we can talk a lot about numbers, and I think the data points that we have are very impressive, but we can never overlook the impact that the sector has on the people of this community. The dedicated and caring individuals working in healthcare provide life-saving care. They ease suffering, they deliver hope, and they deliver healing. That happens every day. It happens every day in a facility like this and facilities across all our member organizations, and that should never be underestimated. Without a doubt, we are a stronger community because of the work that these people do. Also important to note is that Louisville is home to one of the highest concentrations of aging care companies in the United States. The ecosystem includes not only major international organizations, but fosters a growing startup community that's focused on new and innovative solutions. And some of the folks in the audience are representative of that group today. We're also investing in the sector through our Aging Innovation Fund. The Aging Innovation Fund is a $30 million investment fund that's focused on identifying and investing in emerging companies and technologies. And as a matter of fact, we have already invested in companies right here in Louisville. Finally, healthcare is a sector that must be nurtured to ensure a vibrant and growing economy. The Health Innovation Alliance has been chartered by a group of the most prominent healthcare organizations in our region. The Health Innovation Alliance brings together senior leaders from the region's most influential healthcare organizations, and they collaborate on shared challenges. They invest in emerging healthcare technologies, and they strengthen Louisville's position as a national hub for healthcare leadership and innovation. Our members are payers, they're providers, they're academic institutions, they're service organizations, some of which are traditional competitors, but they all come together on shared challenges, and our Health Innovation Alliance is the glue that brings this organization together. Again, I thank you for joining us today, and I would like to now introduce Leanne Barney, CEO of Trilogy Health Services and board chair for the Health Innovation Alliance, and she will provide more details on the organization itself. Thank you.
Thank you, Steve, for the warm welcome, and also thank you for your leadership at our organization. I'm grateful to be here with all of you today, for this opportunity to speak to you about the Healthcare Innovation Alliance. I'm also incredibly proud to be the first board chair of this organization. The Health Innovation Alliance represents what is possible when leaders come together with a shared sense of purpose, vision, and responsibility. not just for our organizations, but for our community and our industry. As we look ahead, I'm especially excited about the 2026 initiatives that are planned for the Health Innovation Alliance. These initiatives position us to have a significant impact locally, regionally, and even nationally. Together, these initiatives are designed to expand our membership, bring new and diverse perspectives to the table, and ensure that innovation doesn't stop at ideas, but that they move forward to have impact. In 2026, we will launch the Healthcare Leadership Institute. This is a 12-month immersive program created to cultivate a connected, high-performing network of emerging healthcare leaders here in Louisville. Through monthly half-day sessions, participants will engage in a dual learning model. This will combine leadership development that is delivered by recognized training partners, but also with the healthcare-specific insights from CEOs locally that will be serving as executives in residence. By learning alongside a diverse cohort of leaders from across the healthcare continuum, participants will strengthen cross-organizational relationships, enhance retention, and help build the collaborative leadership pipeline needed to shape the future of healthcare in our region. We are also proud to introduce the Alliance Network, an exclusive invitation-only community that connects industry leaders with the insights, innovators, and partnerships driving the future of longevity. Launching in the fall of 2026, this program will bridge the gap between emerging startups and established organizations across technology, healthcare, and senior care. Through quarterly roundtables and members-only events, members again will have access to breakthrough innovators, strategic partnerships, and tailored insights, while expanding our membership base and incorporating perspectives from across sectors and stages of growth. Supporting all of this work is the $30.5 million Aging Innovation Fund that Steve mentioned. This fund is intentionally designed to help us invest in the most promising solutions identified through the Alliance's innovation process, ensuring that the ideas surfaced through collaboration, leadership development, and industry engagement can move quickly from concept to real-world application. By aligning our innovation pipeline with dedicated capital, we're able to accelerate adoption, we're able to scale impact, and deliver measurable improvements across healthcare delivery, technology, and the aging experience. Taken together, these initiatives position the Healthcare Innovation Alliance to have even greater impact, both locally, regionally, and even nationally. They reflect our commitment to meaningful collaboration, scalable innovation, and long-term economic growth that benefit both our healthcare system and the communities we serve. As Steve mentioned, our board is comprised of leaders from organizations that are widely recognized as titans of the healthcare industry. Representatives from these member organizations collaborate through the Health Innovation Alliance, as not just as competitors, but as partners, united by a shared mission. And our mission is clear. We want to convene and mobilize the healthcare community to address industry challenges and drive collaboration. We want to identify and invest in emerging healthcare technologies, and finally, to grow regional healthcare economies. The Healthcare Innovation Alliance reflects not only who we are, but what we are striving to achieve. We are bringing together the region's most influential healthcare leaders to drive meaningful innovation, accelerate economic progress, and improve the aging experience for individuals across our community. We are proud of the momentum already underway and genuinely excited about the opportunities ahead. So to help underscore the importance of this work and its impact on the city and the region, it is my honor to announce the Louisville Mayor, Craig Greenberg. Mayor.
Thank you so much, Leanne and Steve. It's great to be with you all here today at U of L's new West Tower. It's also fitting to think about how much the healthcare industry and the city have in common. As we're facing record snowfalls coming this weekend, both the city will have to stay in business 24/7, as will your healthcare companies. We do share a lot in common, and we will keep it going. And to everyone who's here today, the healthcare leaders, clinicians, and staff, thank you for what you all do. Your work touches every Louisvillian's life, helps improve lives every day. One of our administration's focus is helping to make our city safer, stronger, and healthier. And what you all and your colleagues and everyone that's part of the Health Innovation Alliance do play a key leading role in making that happen here in Louisville. As we're standing in U of L Hospital's new West Tower, we can think about the powerful significance of this investment. It's confidence in our city's future, growth that's happening right here in Louisville. This facility is just one of many examples that show a commitment to patient care, to workforce development, and to leadership across the city, across the entire country from right here in Louisville. And as Leanne and Steve just touched on, we all know that healthcare is a cornerstone of our economy here in Louisville. So much of it is happening right here in and around the LouMed district with exciting things that are going on here and across the city, where research, education, and clinical care comes together, whether it's right here in the heart of downtown in LouMed or elsewhere around the city. You all are key leaders. And the Health Innovation Alliance is incredibly exciting because it's going to play such a critical role in bringing together you all and other healthcare leaders from so many of our community's businesses and organizations. And it's great to see that you all can set aside some of the competitive tendencies to serve as stewards of what the future of healthcare will look like for this city, for this state, for this entire region and beyond. And this economic impact report that you've heard and where Steve provided some of the data on is important because it quantifies what so many of us already know, that healthcare is one of the strongest pillars of Louisville's economy. It's one of our largest employers, supporting tens of thousands of high-skilled jobs, high-wage jobs that support families all across this entire region. From pediatric care to medical research to world-renowned aging care to the leaders in medical and pharmaceutical logistics, it's all happening right here in Louisville. And these jobs generate economic impacts and so many other positive impacts that extend far beyond the boundaries of any hospitals, any corporate offices, into every corner of our city, fueling so much growth in so many different ways. And we're excited as new companies that are launching here in Louisville going to grow to be the next businesses that can become part of the Health Innovation Alliance. The Health Innovation Alliance's member organizations represent some of our most significant economic drivers in our community. Thank you to all of you for what you've done, and we're here to support you for what you do in the future. What distinguishes Louisville is the willingness of healthcare leaders to collaborate across systems and sectors when the community's well-being is at stake. And that collaboration is essential as we address workforce shortages, prepare the next generation of clinicians, and adapt to incredibly rapid changes in care delivery. These partnerships matter, and having strong healthcare partners and strong city that can work hand in hand together is going to bode so well for the future of our city, our state, and our country. When we see healthcare organizations thrive, we see improved outcomes for our residents, stronger neighborhoods, and a more competitive economy. So I am committed to being a partner in the work of the Health Innovation Alliance, to be a partner and a supporter of each of your organizations, however we can help you grow and thrive here in Louisville, around the entire country, around the world. We want your innovation and growth to happen right here. Thank you for your commitment to Louisville, and I look forward to supporting you all as we move forward to make Louisville, to make this country an even healthier one. Thank you all very much, and congratulations to the Health Innovation Network.
All right. Good morning, everybody. Smile. This is good news. All right. So it is truly an honor to be here. I'm Trevor Paul. I'm the Chief Executive Officer of the Louisville Economic Development Alliance. And, you know, when you work in economic development long enough, you begin to notice a pattern. Cities rise at the speed of their superpowers. And for Louisville, it is abundantly clear that one of our key superpowers is and has always been healthcare. Not just as a service, not just as a safety net, but as an innovation platform. Now, I'm going to brag on you for a little bit. You may know most of this, but it's good to be reminded of this. You know, this was one of the first places in the country west of the Appalachian Mountains that have a medical school. You used to treat river travelers, and you parlayed that into a 20th century where you built world-class institutions that trained famous physicians, that led advanced clinical trials, that anchored and still anchors whole city blocks. You allow Louisville to claim multiple dramatic firsts, from the first modern emergency room to pioneering heart surgery and hand transplants. And then year after year after year, all of that activity then created the conditions for a Fortune 50 healthcare company to be born. And, as Steve mentioned earlier, the world's largest concentration of headquarters for aging care. And then, year after year after year of that, you've attracted some of the best executive talent, actuarial science talent, IT talent here to Louisville, to change the world from here in Louisville, as well as a flywheel of spin-offs and suppliers and startups and second careers. So basically what I'm saying is Louisville is a player in healthcare, not just because of your heritage, not just because of your GD contribution, but because you all have range. If you think about like Louisville compared to other mid-sized cities in America, they don't have the full stack that we do. We have major healthcare systems doing complex care delivery. We have an R1 university running clinical trials. We have a global payer downtown, largely based here. We have a growing startup ecosystem, especially in digital health. And we have a talent pipeline that extends from our community colleges to our med school. That combination is rare. Talk about a city that's prepared for the future of global health. And you know, cities also need a group like Healthcare Innovation Alliance to provide us with a North Star as we approach this sector. I'm going to use these numbers when I'm in Boston and Silicon Valley trying to sell companies on Louisville. And I love that this group of CEOs is like in the same room, using real data, aligning priorities. I mean, acting like a system versus just a collection of institutions, as the mayor alluded to earlier. The study released today is evidence of that. And as Steve alluded to earlier, it's abundantly clear, but equally profound, that healthcare is still a growing industry in this town. Sometimes we forget that. It is still a new driver of employment, new supply chains, new research funds, new venture funds, new HQ attraction, and continued resilience in downturns. All the metrics that add up to a healthy economy. So in closing, I, like you, fundamentally believe that Louisville's best days are ahead when it comes to impacting the future of global health. From a River City training platform for frontier doctors to now a modern metro that is delivering care models all over the world. We are all part of this long arc. And this long arc is going to be a great ride, and I'm feeling so fortunate to be on it. I know our team at the Louisville Economic Development Alliance feels fortunate to be on it. And now let's go. The time is now. So with that, I want to introduce the star of the show. My communications director actually was a student under Professor Lambert. He made statistics and civics fun, which isn't easy. So with that, from University of Louisville School of Business, Dr. Thomas Lambert.
He's very generous, so thank you, Trevor, for your thoughtful and very kind comments. Although I have been blessed with many great students over the years, I will say that. Also, let me acknowledge the help of the graduate students who helped with this study last fall at U of L, who helped out Amanda Bustamante, who's here in the back, Ellen Everett, who's seated there, Ariel, is she here today? Ariel Heilman? No? Okay, Colin King? Colin's not here. Okay, well, we've got 2 out of 4, so I just wanted to recognize them. That's only fair. They were very, very helpful in this study, getting it done, doing a lot of data collection and analysis along with me. So let me have some comments here, and pardon for reading so much, but just some quick comments. Healthcare is not just a service sector, it is a cornerstone of the American economy, even more so after the Second World War. Today it represents roughly 17 to 18% of U.S. GDP, a share that has grown dramatically over the past several decades, competitive with manufacturing, So that growth has translated directly into jobs and opportunities. In just this century alone, healthcare has generated millions of new jobs nationwide, making it one of the strongest employment engines in the country. Because of its scale and impact, state and local governments increasingly view healthcare as a key driver of regional economic development and long-term tax-based growth. I was thinking back this morning to when we had the Bucks for Brains program here in Kentucky, started under Paul Patton, and how that generated a lot of research and development. And we have a spinal cord injury program here at the university, which is funded through state tax dollars as well, which has generated a lot of impact in this area. I did an economic impact for them a couple of years ago. So nationally, clinical health care providers and health insurance continue to grow at a steady pace, about 4% annually, driven by increased demand and aging population and higher utilization of care. And we know that societies throughout the globe, once they start achieving a certain level of development and GDP per capita, or standard of living, if you will, the demand for better health grows as well. The demand becomes more inelastic, we like to say in economics, if you pardon the jargon, for better health care, better standards of living, not just materially, but also your health as well. At the same time, the industry faces real challenges, including workforce shortages, consolidation, regulatory pressures, and rapid technological change. Here in Kentucky alone, clinical health care vacancy rates are estimated at nearly 9%. I recently did a study with a counterpart at Murray State University, where U of L and Murray State are working to have a medical school campus down there. Physician shortage in Kentucky is still forecast to be about 3,000 or more doctors short by the year 2030, if I recall correctly. So lots of needs, or lots of jobs need to be filled heading down the road. And then, of course, healthcare employers help our area, the metro area, invest in human capital through college tuition remission programs. Humana provides generous tuition remission for people to finish their degrees. Same for U of L Health, does the same thing with the University of Louisville. So our healthcare employers help invest in developing our workforce through college assistance programs. So these national dynamics form the backdrop for the work being done by healthcare employers right here in the Louisville metro region. So with all of this in mind, our report examines the economic impact of healthcare across Kentucky, Indiana metropolitan area. What we find is clear: through direct spending and powerful spin-off effects, healthcare makes a substantial and essential contribution to our local economy, supporting jobs, growth, and long-term regional vitality, as the charts over here point out. Based on this economic modeling, healthcare generates approximately $37 billion in regional economic output across Louisville. The multiplier effect is significant. For every dollar produced by the healthcare industry, another $1.70 is generated in the local economy, meaning healthcare more than doubles its impact across our region. Pretty substantial. These findings reinforce the purpose of the Healthcare Innovation Alliance to unite healthcare leaders and demonstrate that this industry is about more than patient care. Healthcare is a driver of stronger, more resilient communities, supporting the systems we all rely on, including education, transportation, and public safety. This analysis puts numbers to what many have long understood. Healthcare fuels innovation while strengthening both civic and economic prosperity throughout the Louisville region. By highlighting this data, the Health Innovation Alliance positions itself as a connector, bringing together organizations that advance both economic growth and social well-being. In short, healthcare is Louisville's foundation, and the Health Innovation Alliance is the voice connecting that impact to action. Very important organization. So, thank you. Steve?
Well, I'd like to thank everybody for coming today. We are unbelievably excited. And I'd especially like to thank our members, those companies that have established this organization. I thank them for their vision to create a future that is different than what we have today, and creating a future where we have a nationally recognized healthcare ecosystem that's right here in Louisville. We have a healthcare ecosystem that is attracting people that are coming into the city. We have a healthcare ecosystem that are creating jobs, that is spinning off revenue. That's where we are, and we need to get more of it. I'd also like to thank the mayor for the city's partnership, Trevor, your partnership, Leanne for your leadership on the board, and Dr. Lambert for putting data behind something that we've known all along. I'd also like to say that there's some snacks and food at the back if you'd like to go ahead and get those, but I really do appreciate that, and if any of the media would like to have any questions, I'll be available right afterwards. So thank you.